So why get a dental implant if you're just missing one tooth? I mean, what are the advantages over, I guess, traditional dentistry?
Well, Randy, in traditional dentistry, when I went to dental school, the only thing we had available was to do a bridge. And a bridge is a nice appliance, but unfortunately with a bridge, we have to sometimes cut down or do a preparation, which is cutting down a natural tooth to replace that missing tooth. We also know from the dental studies, unfortunately, that the lifespan of a bridge is somewhere between 10 to 12 years. So if you're young, let's say in your 30s, and we're doing a bridge, the likelihood you're going to have that done again is pretty high. And most people don't want to do things over. And secondly, it's not necessary to cut down perfectly good teeth. So what we have today, which is the #1 choice for patients who are losing a single tooth, is to do an implant the same day that you take the tooth out, and we'll put a tooth right on top of it. So they walk out with a tooth on the implant within 2 hours of seeing us in our office.
Makes sense, but is it more expensive to do an implant?
They're about the same. There's really not that much difference between the two. If you look at the bridge over a lifetime, which lasts 10 to 12 years, you're married to that dentist for a lifetime of having those bridges replaced and replaced and replaced. And I find that every time you replace it, you usually cut down more teeth. So it's an ever-ending thing that keeps going. Whereas if you do an implant, that's only that area. You don't do anything to the teeth on either side. It saves the bone. You don't have to have root canals. It doesn't get tooth decay. And it is very, very durable. If you get hit again, it isn't going to be the implant that's going to fail, it's probably the tooth. So from a durability standpoint, the studies show it's probably the most conservative and it is the most long-lasting replacement that a dental patient can get. So I'm an advocate for the dental implant versus the bridge. And I think that what we're seeing now, because we can do them the same day, as opposed to we had to take the tooth out, let it heal, put the implant in, let it heal, uncover it, let it heal. It was a 12-month process.
So you're doing it then in one day for a single tooth implant?
That is the most common.
But is it true it may take like 9 months or 12 months that the bone has to grab onto it over time?
Yes, the bone does have to grab onto it, but that was in the days when we thought that's what you had to do. But today, with newer technology and newer research, we have found that we can take the tooth out, put the implant in, have it be stable, and the patient goes home that day with a tooth on it. And the results of the study show there's absolutely no difference than when the patients had to wait 9 months or 12 months. And the reality is patients hadn't gone towards implants because they thought it was going to be this drawn-out process and they wanted the bridge sooner. But the truth of the matter is, long-term, the bridge is going to be less comforting to the patient. It's going to cause bone loss around the false tooth, whereas the implant doesn't get tooth decay, doesn't need a root canal, doesn't cause sensitive teeth like some people have. And in many cases, the tooth that we actually build on the implant looks better than the natural tooth, and we only have to match one tooth, not 3 teeth. So there's a lot of advantage to having the single tooth implant over the bridge. Randy, in St. Louis, it's still happening. It's probably the most common type of procedure where the patient gets the tooth taken out, they have to wait, the implant goes in, they wait, they have to have an uncovering, they wait. I don't know why dentists haven't grasped this, because we've been teaching this for over 10 years. I'm still teaching it.
They need to go to your course.
They need to go to a course on contemporary implant dentistry. And that's what we're doing in our practice. We're doing state-of-the-art, which is based on the research available, a standard of care. We're doing what I consider to be the best implant therapy possible. And all I can say to those patients who are going to other dentists is I hope those dentists get trained. I hope they come to a seminar somewhere where they can get some help and a better understanding, because the truth is they'll be better serving their patients by not delaying these treatments.